Hey, how are you going? This is just a quick additional tutorial that's pre-recorded because we just didn't get through all of the lower limb in the tutorial. And so what we just need to go over in this is the neurovascular structures. So the arteries, the veins, and the nerves, and I'll just touch on some cartilage as well. So the arteries, they take the blood away from the heart and down to the legs, and we sonographically will do like arterial duplex it's called, and investigate the arteries of the leg, more to see if there's any blockages in that, which you can get with bits of what we call atherosclerosis and plaques, and it can happen with people that have diabetes or are smokers or just other sorts of issues. So I've drawn a picture here, and these funny things are supposed to be the iliac crest and the pelvis, and then this is the pubic bone here. And so you can see our aorta, and then we'll just remember our pelvic anatomy. It divides into two common iliac arteries, and then it gives off that internal iliac artery. And we've talked about all those different branches of that internal iliac artery. Once that's given off, it becomes the external iliac artery. And then right at the groin crease, and the groin crease is if you're sitting down where your leg bends from your pelvis, that's your groin crease. And if you put your finger right in your groin area there, that's the region of what we call your common femoral artery. Sorry, my mouse is going really slow. Just in here is the common femoral artery, just here. And so it's quite short, it's maybe about that short. And that's what they often call the femoral artery at the groin, but it's really called the common femoral artery. And then it gives off a deep branch, and anything that's deep in arteries is called the profunda femoral, which we're not too worried about. Then the main thigh artery that we have, which runs on our inner thigh really, is called our femoral artery. And then it goes from the inside of our thigh and then around the back behind our knee. And once it goes behind our knee, it's in our popliteal fossa, and it's called our popliteal artery. And then it gives off a branch which goes to the anterior lower leg called our anterior tibial artery. And then there's a common little bit after that, and the common little bit is this, and we call it the TPT, the tibio-peroneal trunk, and that's because it's a trunk that gives a rise to a tibial and a peroneal artery. Sort of think of it like, you know, where your sciatic nerve divides, but it gives off the posterior tibial artery and then a peroneal artery. And so you can see I've written the names there. And so they're all the names of the arteries in the leg that you really need to know about. This anterior tibial one, it runs sort of anteriorly and sort of laterally down the leg, and then it runs into your foot and gives off a artery at the front of your ankle called your dorsalis pedis, which is what I'm calling here the DP. And your dorsalis pedis is a little vessel right at the front of your ankle, and that's where we feel what's called a pedal pulse or a foot pulse. Pedal means foot. So you'll see your anatomy pictures, they tend to look a bit more confusing. So I tried to just break it down and draw it there for you so that might make it a bit easier for you to understand. You might want to refer back to these in third year when you have to do your vascular ultrasound and need to understand this anatomy really well. So as I said, the popliteal artery is in the popliteal fossa, and remember our popliteal fossa is the back part of the knee, it's the posterior knee. And remember in res school we looked at the position of the popliteal artery relative to the popliteal vein, and how do you think you would describe that? So the way I tell students to remember it is the most important vessel, because we have the sciatic nerve, the popliteal vein and the popliteal artery, they all sit together. But the most important vessel out of the artery and vein there is really the popliteal artery. And that's because it has to take oxygen and nutrients to the lower leg, and without that, you know, the leg's not going to survive. So that's deep. So it's when you look from a posterior approach, the artery needs most protection, so it's the deepest. So it sits down deep, close to the femur and the bone in that popliteal fossa. Your femoral artery, as I said, it goes really from your groin crease down in your inner medial thigh, and at the groin crease area, see how they call it the femoral artery, but typically we call it the common femoral artery. I mean, either can be right, but the artery sits here and it sits in between the femoral nerve and the vein. So the vein is the most medial structure in your groin, and that's really important that you understand that. The femoral nerve is really quite short and then it branches out. So this is just the femoral nerve here and it branches out into all different nerves. So it's not a big nerve. Like we have the sciatic nerve, that's a big nerve in the back of our thigh. There's not one dominant nerve that's in the medial or anterior part of the thigh. So this is what we will typically look at in ultrasound, and the vein is typically larger than the artery, and we can tell that this is medial here and this is lateral because we're going vein, artery, and then that's the nerve, the femoral nerve there. So from medial to lateral at the groin, it goes vein, artery, nerve. Sorry, my computer's just really slow. So as I said, there's pulses that you can measure, and that's just where you're measuring the pulse of the blood flow in the artery. And so you can do a femoral pulse, you can do a popliteal pulse, which will be back around the back of your knee. Then you can do a posterior tibial pulse, so that's on your medial ankle, because your Tom, Dick, and a very naughty Harry is the RA is the posterior tibial artery, and then your dorsalis pedis comes around the front of your ankle and down here. And that's that vessel, it's the continuation of your tibialis anterior artery. So your thigh arteries really sit in the medial thigh. They're the main ones. You have some deeper ones, but these are the main arterial supply to your leg, and it sits medial. Where you have femoral vessels, it gets confusing. You have a saphenous nerve. I don't know why they didn't use the same names for things. It's so confusing. Because as we get onto veins, you'll see that the saphenous veins sit superficial. Here's some more things about the thigh arteries. I think we've covered all of that. Here's our popliteal fossa, and you can see the artery, most important vessel, it's the deepest, sitting down closer to the femur from when you look from a posterior approach. And we could see that on ultrasound. So we had the probe on the back of the knee, and we could see the tibial nerve. I think I said the sciatic nerve before. The tibial nerve, the popliteal vein, and then the popliteal artery is the deepest. So our sciatic nerve here, it divides into our tibial nerve and then our common peroneal nerve, and it's the tibial nerve that sits with our popliteal vessels. And like I just said, in the lower leg, the sort of below knee area, there's three main arteries: anterior tibial, posterior tibial, and peroneal arteries. Remember, the tibio-peroneal trunk is like a common bit that gives rise to the posterior tibial and peroneals. Okay, we'll go on. You can pick it there. Covered the femoral arteries. Now the veins. The veins are slightly different. The deep veins of the leg are exactly like the arteries. They're exactly like the arteries, except that in the lower leg from the knee down, the veins are all paired. But they all share the same names. And so here's another one of my dodgy drawings, but I hope you can understand it. Iliac crest. Then we've got sort of our pubic bone, so the front of that pelvis here. And you can see we've got, remember the veins, the blood will go from the feet back up to the IVC, and then it goes up into the right atrium of the heart. Remember that. And so it divides the same way. IVC, common iliac vein, gives off the internal iliac vein, then it becomes the external iliac vein right in the groin crease region. It's called the common femoral vein. It gives off a deeper branch called the profunda femoral vein, but in the medial inside part of the thigh, it's called the femoral vein. Then once it runs through what we call the adductor canal, like where your bottom parts of your adductor muscles are, it goes posteriorly, goes into the back of your knee, into your popliteal fossa, becomes your popliteal vein, which sits between your tibial nerve and your popliteal artery, with the popliteal artery deeper. And then it does the same thing. It first of all gives off your anterior tibial veins, but they're paired. That's the only difference with the arteries. Then there's a tibioperoneal trunk, which gives rise to posterior tibial and peroneal veins, but those veins are all paired. So where we had one artery here and one artery here and one artery here, we have two veins. And when we look at them sonographically, they look like a little set of traffic lights because the veins sit on either side of the arteries. Covered that. Then that was our deep veins. So when we talk about a deep vein thrombosis, that's a clot that happens in those deep veins. We also have another sort of lot of veins called superficial veins, and they sit superficial to the muscles. And so they sit superficial to the fascia that covers the muscles. So basically these veins sit between the skin and the fascia. So they sit in fat, a fatty layer, the subcutaneous fatty layer between the skin and the fascia that overlies the muscles. And these are called our saphenous veins. And so saphenous, this word here. And basically we have a really long one, which basically runs from our groin all down the inside part of our leg, down to our inside part of our ankle and sort of behind our medial malleolus here. And then we have a short one, and the short one's on the back of our calf, and it runs right in between, like, well, superficial to, but at the junction of where our medial and our lateral gastrocnemius muscles join, and it sits superficial to that. And so this one's called the long saphenous, or the great saphenous vein, the one that runs all the way down the medial part of the leg. And the one that runs down the back of the calf, it's called your short saphenous vein. So just remember, saphenous means a superficial vein of the leg, and not to get confused with the saphenous nerve, but saphenous veins are the ones that we look at a lot more commonly. So this long or great saphenous vein comes up and it drains all the way back into our femoral vein at a junction called the saphenofemoral junction, because it's joining up the saphenous vein to the femoral vein. And then the short saphenous vein, the one that runs all the way down the back of our calf, it joins up to our popliteal vein at the saphenopopliteal junction. So at some point our superficial veins drain into our deep veins. So superficial veins are the ones that you have all the varicose veins that are associated with, and they're easy to see because they sit just under the skin, between the skin and the muscle fascia. So you can see these are tortuous varicose veins there. So your superficial veins in your thigh, it's just going to be your great saphenous vein that runs on the medial part of your thigh here, and then in your you can see that coming down. And so you can see here in these pictures, these are quite good. There's the skin, this is the subcutaneous fatty layer, and then this is the fascia here that overlies the muscle, and you can see that the superficial veins sit between the skin and the muscle fascia. And here's your short saphenous vein around the back of the leg. It sits between your skin and your muscle fascia. And that's just what a superficial vein is. So you can see where your great or your long saphenous vein is. It runs along that medial part of your thigh. And then when we scan them, and we scan them a lot, we put the patient in this position. So it opens up the medial part of the thigh. There's the skin, and this is going to be the muscle fascia, and this is what the vein looks like. And we can see it, and then we compress it, and it goes away. So here's the skin, here's the muscle fascia, and here's the great saphenous vein. And we would just have the probe on the thigh at about this region here to get this image. Then, so you can see the long saphenous vein, so it's sometimes called great saphenous vein or long saphenous vein. It's the same thing. Why they don't call it the same thing? I mean, it means the same thing, I suppose, really. And then at the back, oh, well, we're in the thigh here, so you won't see a short saphenous vein. But in the lower distal calf, you can still have your long saphenous vein medially, and then you have your short saphenous vein. And can you see, like I said, it sort of sits between where your medial and your lateral head of your gastrocnemius join, and that's right in the middle back part of your calf. So that's not really a great picture. The old style stockings used to have lines that ran all the way down, and this short saphenous vein sits where this stocking mark would sit. So if you followed a stocking mark up, and then it would join your popliteal vein around there. That's your short saphenous vein. There it is, pop, and it joins your popliteal vein. And so here's your medial head of your gastrocnemius, here's your lateral head of your gastrocnemius. I've sort of cut off the skin, but the skin would be here. This is the muscle fascia, and you can see that the short saphenous vein is sitting between the skin and the muscle fascia. It's very superficial. The nerves, I mean, the main one you need to know about is your sciatic nerve, and that femoral nerve, it comes anteriorly, it sits anterior to the groin, but remember your femoral nerve, it sits deep to your piriformis muscle, remember, in the pelvis, and then it exits through to the back part of the thigh, inferior to your piriformis muscle. And so then it runs down the back of your thigh here, and then it divides into your common perineal or common fibular nerve, and then your tibial nerve. And your tibial nerve is the one that sits with your popliteal artery and your popliteal vein. With your popliteal artery, the deepest position, because it needs to be protected when you look from a posterior approach. We think we've done the sciatic nerve. You can see now where it sits, so it would exit under your piriformis muscle out here, and it comes down. We've looked at that in res school. We've seen it bifurcate into common perineal or common fibula, you can call it whatever you like, and your tibial nerve. I think we've covered this. VAN, vein, artery, nerve in the groin from medial to lateral. The nerves in the thigh, really we have a very piddly little nerve that runs with those femoral vessels, and it's a saphenous nerve. It's not so important. The main big nerve in your thigh is your sciatic nerve. And then your tibial nerve and your common perineal nerve in your lower leg. They're the main ones that you need to know. I'll just quickly go over cartilage. I just don't know if I got a chance to talk about it. Cartilage is important to understand. We started mentioning it up at the hip, and we said that, remember, they had this os coxae bone or hip bone or pelvis, hemipelvis, is made up of the three bones, the ilium, the pubic bone, and the ischium, with the ischium being at the back, because the ischium's the bit that we sit on, and it's the bit that that ischial tuberosity here, it's a really important bit because that's what our hamstring muscles proximally attach onto, don't they? We've got a conjoint tendon of our biceps femoris tendon and our semitendinosus tendon, and a bit lateral to where that attaches is our semimembranosus tendon, which attaches onto that ischial tuberosity just a bit lateral to the conjoint tendon. But these three bones are joined together when you're a baby by cartilage called triradiate cartilage, because it's got three bits to it. And that's why when we take a X-ray of the baby's hip, we can't see that acetabulum because it's still cartilage, because that triradiate cartilage takes up a lot of the space. At the ends of bones, we have articular cartilage. So our joints are called articulations. And so the cartilage that's going to be at a joint is called articulation cartilage, which we just call articular cartilage. And so anything that's lining the end of the bone, like here, that lines the head of the femur, that's called the articular cartilage. We also have articular cartilage around the distal end of our femur and the proximal end of our tibia, and it also lines our patella, because the articular cartilage comes all the way around the femur to probably about here, and then we've got patellar cartilage that lines the deep aspect of the patella. So we can see this is a bit of the patella here on this image, we've got a bit of a thick looking quadriceps tendon here. We can't quite see our patella tendon that would sit in here. Remember, we've got a fat pad that sits in here. Do you remember what that's called? It's below the patella, so it's the infrapatellar fat pad or Hoffer's fat pad with a capital H. But the back part of the patella, the kneecap, is lined with cartilage, and that's called patellar cartilage. It can be called the patellofemoral cartilage as well, and it's really important. We can't see it sonographically, but we can get a lot of problems with it in patients, and we do need to see it on an MR. But because we can't see it sonographically, we forget it's there, and it's really important that we don't forget it's there. That articular cartilage is different to other sorts of cartilage like our meniscus and our labrum, and that's called fibrocartilage. So these little menisci here, our anterior and our posterior meniscus, are fibrocartilage. And we also have the triangular fibrocartilage in our wrist as well. So when we take an x-ray of the knee and we do it like the knee's bent here and we have to send the x-ray through here, it looks like there's a big gap. But in reality, there's not. There's cartilage that lines the femur and cartilage that lines the back of the patella. So there's patellar cartilage along here and femoral cartilage along here. And so we have to remember that cartilage exists. We also have cartilage that lines in our ankle joints. We have cartilage that overlies the top part of the talus and the bottom part of the tibia there. Also at the bottom of the fibula as well. So you can see this funny stuff here, that you always see this in the anatomical drawings, and that's your articular cartilage. I think that's it. That's all I'm going to spend time on. I just wanted to clarify a few of those points because I didn't feel like I got enough time to do that properly in the tutorial. Thank goodness the lower limb is over. Bob is really happy. You can't see his tail. It's in high motion. I hope your revision's going well. I hope that helps to clarify something. I hope my dodgy drawings, even though they're dodgy, might just help to clarify out a few of those veins and things and arteries for you. I'll leave it there. Good luck with everything. Bye.